We are again here to have the last session of a fatty liver, and today our topic of discussion is fatty liver and men.
Yeah.
So Farah, tell me, last time we discussed that how women health gets affected due to fatty liver.
Correct.
So today I would like you to throw some light on fatty liver and men. Why do more men have seemed to be getting fatty liver compared to women?
So Seema, severity and prevalence both are high in male for fatty liver in comparison to the women. Why so? Because Seema, there are two kinds of fatty liver. One is alcoholic and one is non-alcoholic. So we are talking about non-alcoholic fatty liver diseases from our first series. So today I will give you a small brief of alcoholic fatty liver also, because alcoholic fatty liver disease is very common in men. And why it is common in men? One reason is intake of alcohol. So more than 2 drinks every day if anybody is taking, and their liver and their lipid parameters and sugar parameters are on the higher side, they must go and check their fatty liver.
Okay.
So one is this, and second is our common thing is non-fatty liver diseases. So for non-fatty liver diseases, we consider men who have obesity or overweight, diabetes or insulin resistance, or increased triglycerides, increased low density lipoprotein, which is LDL. When these 3 things are there, they must check their fatty liver, because these people have fatty liver diseases. So in comparison to men and women, 19% women have lower chances of getting fatty liver in comparison to men.
But what bracket of women do you feel get affected by this non-alcoholic fatty liver?
So Seema, basically these 19% we consider a female who got menopause. Only those females are on the higher side of getting the non-alcoholic fatty liver diseases. Also Seema, lifestyle. Lifestyle matters a lot, and in men's we can see in our daily practice that men have erratic eating habits.
Yeah, you're right.
Now we are thinking कि मैं ये healthy drink पी रहा हूँ, I'm having only the fruit juices or mixed fruit platters. So this fructose is also not very good for fatty liver diseases, and the fructose may increase fatty liver disease, the non-alcoholic fatty liver disease.
Okay. Now in between, as you mentioned that after menopause, women are seen to have non-alcoholic fatty liver. That means hormones have a role to play.
Correct.
So in context to this, I would ask you a question. Is men's health, hormonal health in fact, also gets affected if they have non-alcoholic fatty liver?
Why not, Seema? It is again correlated.
Oh.
Obesity, diabetes, in दोनों के बीच में insulin resistance, and as I told you, increased triglycerides and increased LDL. It affects on visceral fat. जैसे जैसे visceral fat, liver fat increase होगा, सबसे important male hormone is testosterone. वो डिटोरिएट, उसकी क्वालिटी एंड क्वांटिटी दोनों डिटोरिएट होना शुरू हो जाएंगे, और जैसे वो डिटोरिएट होगा स्पर्म काउंट्स कम होंगे, सो फीमेल्स में वैसे इनफर्टिलिटी इज वेरी कॉमन, बट व्हेन यू हैव NAFLD or alcoholic fatty liver diseases, it impacts on the testosterone and sperm counts, and it can give infertility even to the males.
Oh, that's a very important point.
Yeah.
Not other environmental issues. Apart from that, non-alcoholic fatty liver also has a major role to play in hormonal health in men.
Yes, it's very important. I mean, sometimes males think that it's only the female who has hormonal issues, but yes, testosterone's deteriorated quantity and quality of testosterone, it's directly connected with liver fatty liver diseases, obesity, insulin resistance and diabetes.
Okay, Farah, there's another question just came to my mind when you were talking about this fatty liver. That is waist circumference.
Yes.
Because generally we see men generally have a very bigger waist circumference. Is also related to non-alcoholic fatty liver?
Yes, waist circumference is also one of the parameter we can consider for obesity or for overweight. Usually हमने सीमा देखा है कि वैसे तो पूरी body is fine, only हमारा मेल्स में वेस्ट सर्कमफ्रेंस ज़्यादा होती है, हॉट बेलीज है और थोड़ा बेलीज निकली हुई हैं, तो उधर भी बहुत ज़रूरी है दैट वन शुड do the lifestyle modification, and we also should correct our exercises, etc.
Oh yeah.
Yeah.
It's a wonderful point. One should note that.
Yeah.
That how men's health gets affected by non-alcoholic fatty liver.
Yes. So Seema, now I have a question for you. Is fatty liver related to metabolic syndromes?
Yeah. Firstly, I would like to tell you what is metabolic syndrome.
Yeah.
When somebody has 4 major issues like high blood glucose levels, which is also known as high blood sugars, high triglycerides, which we call as TGL, low HDL, which is good cholesterol, and high blood pressure. All these 4 components together form metabolic syndrome. Fine. So apart from that, if you are obese, then definitely it's adding to this metabolic syndrome. Now, since we are discussing non-alcoholic fatty liver, I would like to tell you a connection between metabolic syndrome and non-alcoholic fatty liver.
Okay.
What happens is, because of this fatty liver, there are high triglycerides, the liver is overworking, and there is a high blood glucose levels. Because fatty liver is there, blood glucose levels are rising, high triglyceride is happening, and you are leading towards metabolic syndrome.
Okay. Okay. So Seema, it's like increased sugars or fasting blood sugar?
Yeah, fasting or can be random also.
Okay. And lipids, so
Yes.
triglycerides.
Yes.
And third is
High blood pressure
high blood pressure.
and
Okay.
even HDL.
And even
Low
HDL. Low HDL, which is good cholesterol. Okay,
Yes.
good to know.
Yeah, so all these together, these 4 components form metabolic syndrome. And if an individual has any 2 components on the higher side, that means या तो blood sugar बढ़ा हुआ है और high blood pressure है, but definitely you have fatty liver, which is leading to metabolic syndrome.
Okay, got it. Okay, so Seema, now my next question for you is, which diet can help to reduce the fatty liver?
Yeah, since we are
I think this is very important question because we are nutritionists, so we have to take this question.
Yes. So diet is a very important thing. Firstly, we need to do healthy eating. When I talk about healthy eating, it is balanced diet. And when you talk about balanced diet, the most important thing is you need to have a sensible portions.
So portions, I mean Seema, sometimes when we say portion, so people say, okay, I am eating less but still I have this issue. So what exactly, I mean how we check the portion?
Yeah, it's very difficult to decide on day-to-day basis because someday you like something, you eat more. Someday you don't like something, you don't eat.
Yeah.
So in that case, our program Metabolic Balance really helps. Here we generally take a person's medical history, food choices,
Yeah.
his entire blood issues, and we get a plan formulated. It's a personalized plan. And in this plan, the person portions needed for metabolism correction.
Correct. So it's like insulin correction also.
Yeah. And that is how a portion control, I will not use the word control because control has a different meaning for everybody. I mean sensible portions of food one needs to take. Another important thing is having complete gap between meals. What happens is we have a good breakfast, a good lunch and a good dinner, but in between we keep eating little here and there. Especially last week when it was Diwali.
Yeah.
There was dry fruits in the house. There were so many different kind of sweets in the house.
Everybody was munching.
Yeah, one piece of nut or maybe one kaju or one small barfi we were eating, thinking ki this will not add to my weight. But this eating in between meals, like between breakfast and lunch, we recommend a gap of 5 hours. So Farah, can you throw light on this? Why we need 5 hours gap?
Yeah. So Seema, 5 hours gap is necessary first to correct the insulin, to correct the insulin resistance, and the gap, when we are giving the gap, our body releases glucagon, which is very, very important, because this glucagon help to first feel you full, and when you are feeling full you can maintain the gap. And maintaining of gap means you are drinking only water, and that doesn't include the coconut water or detox water or green teas, etc. Because when we are explaining this to our clients कि 5 घंटे का break रखना है, we explain them कि diet coke, cokes और शरबत और juices ये सब तो out है, but then they think कि okay, healthy drink is coconut water, healthy drink is green tea, कि भाई green tea पियेंगे तो fat melt होगा, blah 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 things. लेकिन it's not like that. 5 hours break means plain pani, that's it. No munching, just to correct the insulin, because once you are correcting the insulin, then you are actually targeting your fat. Visceral fat भी तभी correct होगा जब आप अपना insulin correction करेंगे.
Very well explained. Another important thing is when we keep having these small things in between, it leads to indigestion. We start getting burps. We start feeling acidic. And on top of it, we keep taking lot of supplements. We'll take some antacids, we'll take vitamin B supplements, we take so many supplements. And what happens? These supplements will also get digested in the liver. They will release toxins and further cause extra load on the liver. So by eating extra food, you are asking for extra supplements. And these supplements along with extra food are definitely affecting your liver. So please maintain 5 hours gap between breakfast, lunch and dinner. But since there's a long gap between lunch and dinner, you can have a cup of tea or coffee, something in the evening. Another important thing is that bitter foods.
Yeah.
Bitter foods like Karela, which are easily available now, it's the season. Muli ke patte, they really help in reversal of non-alcoholic fatty liver. Apart from that, rocket leaves are there. Whichever all these things.
Moringa is, बहुत सारे लोगों को पता है moringa leaves भी बहुत helpful हैं, bitter भी है, and it is good for the liver things, liver disease.
Yeah, so when it comes to healthy diet, clean eating, sensible portions, you need to have only water, maintain 5 hours gap, avoid sugary drinks, take all bitter vegetables. These will definitely help in reversal of non-alcoholic fatty liver.
Yeah. So with this, I think Seema, today we are finishing our fatty liver series.
Yeah, definitely.
So if you wanted to see us fatty liver disease from our first episode till today, you can contact us anytime to our website, or you can subscribe our channel on YouTube.
Yeah, and since from 1st November it is diabetes month, so next month we will be addressing a very, very important topic, which is diabetes. And since India is the second largest capital when it comes to diabetes, so please join us again, same time, next Monday, and we'll be taking on diabetes. Any queries, any information, if you want to share or want to ask, please send us the questions. We will love to address them.